Meanwhile, officials still don't know what's causing a large multi-state outbreak of Cyclospora in the U.S. In today's Health Minute, Mandy Gaither has a glimpse inside one of the testing labs and has more on what they're seeing as cases continue to climb.
At Cleveland Clinic, this lab has become a forefront of microscopy testing for the Cyclospora outbreak. Using a technique called modified acid fasting is allowing for easier detection of the parasite. Since June, the demand here for testing has skyrocketed.
We typically had about 1 to 5 samples that would come in. Currently, we're getting over 200, sometimes up to 400 a day.
The lab's medical director, Anisha Misra, expects to continue seeing high numbers of cases through August, when the season this parasite typically circulates ends. Since May 1st, 1,645 lab-confirmed cases have been reported to the CDC by 34 states. The agency says it's aware of more than 5,100 other cases, but further research is needed to determine whether the parasite was acquired in the U.S. Officials also say the true number is likely higher than what's reported. By comparison, there were 249 cases reported nationally in the same time period last year.
It is a challenge to do traceback and figure out what the culprit might be.
The CDC says past outbreaks have been linked to consuming contaminated fresh produce. Symptoms typically begin 1 week after exposure and include watery diarrhea, which can be frequent, loss of appetite, weight loss, bloating, nausea, and fatigue. Without treatment, the illness can last from a few days to a month or longer. While it can be severe, it's not usually life-threatening. For Health Minute, I'm Mandy Gaither.